also known as coke, powder, and blow, that's commonly used to increase energy levels, social aptitude, and alertness while decreasing needs for food and sleep. It wasn't always used as a stimulant or party drug, though. Cocaine comes from coca leaves in South America and has been used by locals for thousands of years. In the early 1900s, purified cocaine was detached from its plant and used in medications to treat a multitude of illnesses and disorders. Early recipes of Coca-Cola included cocaine, and physicians even used it as an anesthetic for surgeries and subsequent pain control. Later, these uses became strictly controlled as progress in medical research revealed its powerfully addictive qualities, which damages healthy cognitive functions. After swallowing, snorting, or injecting it, a rush of sensations immediately follows that includes euphoria and self-confidence. Just as the rush of sensations develops quickly, they fade quickly as well. These sensations, or the high, can be experienced for up to 30 minutes after ingesting cocaine, but are not quickly forgotten. After a period of some time, many casual cocaine abusers find that they have developed an addiction to cocaine. The National Survey of Drug Use and Health reported that over 900,000 people 12 years and older across the nation admitted to having an addiction to cocaine in 2014. Most people recognize that they have an addiction before others do, as they find out they must maintain a minimum value of regular consumption just to feel normal. However, one of the most notable characteristics of addiction is denial, which operates as a protection for the supply of cocaine that the brain is now accustomed to and in requirement of. An addiction can also be identified when one experiences the following symptoms shortly after his or her last dose of the drug: cognitive difficulties with concentrating and problem solving, fatigue, restlessness, depression, nightmares, anxiety, suicidal ideation or attempts, muscle and nerve pain, trembling, and strong cravings for cocaine. Cocaine abuse becomes the addicted individual's top priority in order to avoid the agony of suffering cocaine withdrawal sickness. Addicted people feel that they have no choice but to use every financial resource to maintain their supply, even resorting to stealing from loved ones and other criminal activity. An addiction is a disease with physiological consequences as well. Important relationships are also sacrificed, and previous priorities for a fruitful and happy life are forgotten. Perhaps the hardest truth for addicted people and their loved one is that addiction can be fatal. Every abuse of the drug is a risk for overdosing or engaging in destructive activities such as driving under the influence or taking chances that would only be considered with lowered inhibitions. A cocaine addiction becomes a dangerous crisis for its victim and his or her family members. But all hope is not lost. Evidence-based treatment has helped countless people overcome their addiction to cocaine and rebuild their lives for a happy, worthwhile future. Several cognitive therapies and a specially tailored program are used to educate patients and their family members on the science behind how cocaine impairs the brain structure, as well as how to reverse the damage. Coping, social, and life skills are addressed, and family therapy is encouraged. Family support highly increases one's potential for living a life of recovery in the long term. We're ready to show you the path you need to take for a sober and fulfilling lifestyle. Give us a call today to get started.
Please feel free to comment, like, or subscribe to our channel.